Presiding Officer, the new First Minister has lots to get to grip with, so I thought it's only fair that we should start with something he should already be across. There is a mental health crisis affecting children across Scotland, but they are struggling to access treatment. During Humza Yousaf's time as Health Secretary, more than 11,000 children and young people waited more than the 18-week standard for treatment. Shockingly, over 14,000 had the referral for mental health treatment rejected entirely. So will the First Minister take this opportunity to offer an apology to the children and families he let down as Health Secretary?
First Minister.
Can I say, as has become customary, of course, when Anna Sarwar asks these questions, he does not acknowledge the impact, of course, of a global pandemic. A global pandemic which has been the biggest shock of the NHS in its 74-year existence. Of course, anybody that has been let down, particularly our children and young people, I not only offer an apology, I offer deep regret for anybody that has had to wait longer. I would not want my loved one, I would not want my children, if they ever needed those services, to have to wait any longer than they should. But we are taking action on recovery. I am taking action on recovery. For example, when we look at CAMHS, when we look at the number of young people waiting to be seen for their mental health, the number of children starting treatment from CAMHS in the most recent quarter is the highest figure on record. The last 4 quarters, in fact, have seen each of the 4 highest figures on record for the number of children starting treatment for CAMHS. So I agree with Anna Sarwar. There are too many young people waiting too long, but this action, the recovery that we have made, the recovery that will now be led, and I will of course lead that from government, but led by the Cabinet Secretary for NHS recovery, for the NHS and for social care, we will make sure that we continue to invest in that. Let me end by saying that it is because of our progressive taxation, Presiding Officer, that we are able to invest a record £19 billion in our health service, and I hope we continue to make improvements in relation to young people waiting for CAMHS.
Anna Sarwar.
The First Minister can't use the pandemic for this excuse because they've never met in 16 years their CAMHS standards. So no excuse of the pandemic on this one. Because incompetence has consequences. Behind these statistics are struggling children and heartbroken families. Here's just one example. 10-year-old Alan Gilbraith. He has been waiting for his mental health treatment to start the entire time Humza Yousaf was Health Secretary. And here's what Alan's dad Robert told us. He is really up and down. He will have days where you won't get a word out of him. We don't know what's happened unless something goes wrong. I feel like he's just been left. It doesn't matter what happens with him. There's been an array of cancelled appointments. We expected them to give Alan a diagnosis, maybe start treatment, something to help, but there's been nothing. All we get when we phone is that we're sorry. I cannot even begin to understand why Alan has gone from ready to start medication to the back of the queue, especially when it's a matter of mental health, and I really fear what further delay will mean for him. We just feel constantly let down. We are very aware of the pandemic, but there is just not an answer, all while my son and my family are suffering. Health Secretary Humza Yousaf failed this family. Why will First Minister Humza Yousaf be any different?
First Minister.
Can I say that, of course, on the individual case that Anna Sarwar references, I'm more than happy to receive the details and see if there's any way that we can assist Alan and, of course, assist his family as well. Let me say once again, I am the first, and have been when I was Health Secretary, to acknowledge that, of course, there are challenges, and there were challenges pre the pandemic. But anybody who, of course, and all of us have lived through the last few years, will acknowledge that the impact of the global pandemic has been felt, of course, in our health service here in Scotland, but in health services right across the UK, and I would say right across the world. And our recovery is starting to see improvement. If I look at the latest, figures, overall CAMHS waiting lists have decreased by a reduction of around about 777 people. Children waiting over 18 weeks has decreased by 1,110. Children waiting over 52 weeks have decreased by 523. That's a 41.9% reduction. And the number of people recruited to CAMHS at a record high under this government and under my tenure as Health Secretary. But all of that, I fully accept, will be cold comfort to Alan, Robert and their family. So I'm more than happy to look at this individual case, but we are on the road to recovery, not just on our health service, but on our mental health services too.
Anna Sarwar.
Presiding Officer, Alan was waiting the entire time Humza Yousaf was Health Secretary. Let that sink in. A young child needing desperate help from our NHS, having to wait the entire time Humza Yousaf was Health Secretary. No hiding behind any pandemic, no hiding behind the statistics in that book. That is families suffering right across this country. And it's not just 2 years of SNP failure, it's 16 years of SNP failure. This government has never met their 18-week CAM standard. And when Humza Yousaf was Health Secretary, Labour repeatedly called for a new referral system so that no young person is rejected for treatment, that every GP practice has a dedicated mental health worker and a mental health A&E in every health board so that patients can be fast-tracked. But they failed to listen. So why can't the First Minister see that for children like Alan and their families, incompetence has consequences, continuity won't cut it, and more of the same isn't going to improve their lives?
First Minister.
Can I again say to Anna Sarwar that I am not suggesting and have never suggested that there weren't challenges pre-pandemic. Equally, I accept, and I hope he accepts, that the global pandemics and the impact of that have been significant, not just on our NHS, but of course on mental health services as well. We know that local authorities report that between January and June 2022, more than 38,000 young people and families accessed over 230 new and enhanced community-based mental health support. Now, why do I mention that? Because CAMS is, of course, important, but our interventions, our investments in early intervention are extremely important as well. I take the point also made about rejected referrals, and that's why we've accepted the recommendations of the report in relation to rejected referrals and the audit that took place in 2018. So I expect to continue to see progress in that regard. When statistics covering Q1 of 2023 are released later this year in June, we're confident that a number of boards will have made significant progress in meeting the standard of 90% of young people seen by CAMS. We know that health services right across the UK have been impacted by the global pandemic. What are we doing about it? Not just making sure that we make right by the recovery of the NHS, but ensuring that we invest a record £19 billion in our health service in 23-24. What else are we doing? We're making sure, and of course I led on this as Health Secretary, that our NHS staff are the best paid here than anywhere else in the UK. And that's why, of course, I'm pleased that we've never lost a single day this winter to strike action, which is very different to other countries across the UK.
Question number 3.